The Chief of Staff, Marshal Sadiq Abubakar, has reaffirmed his commitment to ensure better training for professional security service delivery in the country. The Air Chief gave this reassurance when he visited some states to commission projects. He explained that the military is acquiring the needed hardware to combat insecurity in Nigeria.
His first stop is Enugu State, southeast Nigeria, where the Chief of Air Staff, Sadiq Abubakar, is attending the groundbreaking ceremony of the headquarters complex of the Training Command, a partnership between the state government and the Air Force. According to the Air Chief, the project is expected to boost the efficiency and timely projection of air power.
We are very excited and delighted to have this command in Enugu, knowing fully well that looking at our threat analysis, we believe that having the command in Enugu will add value to what the government is doing to ensure the security of lives and properties of all Nigerians.
The governor, Ugwuanyi, reassures the people of his commitment to ensure that peace continues in the state.
I want to reassure you of our continued support and cooperation towards the success of the command and the sustenance of our relationship with the Nigerian Air Force.
Then he moves further south to Port Harcourt, the River State capital, to commission another set of projects. And there, he reiterates his commitment to professionalism of the force.
Today in Port Harcourt, you are seeing at least 3 helicopters. They are working around the clock to ensure that we have all the assets, to make sure that our communities and our people are safe. And in addition to that, of course, apart from the equipment side of it, we're also looking at the human beings involved. And that is why we're here today to commission the accommodation of the people that are flying this aircraft. And we're also here today to commission the dialysis unit of the hospital to ensure, to give that sense of belonging to our personnel. About flying, in addition to them flying and getting the equipment they require to fly, we're also taking care of their needs, the needs of their families. The whole idea is to have a professional Air Force.
He also commended his team for their tremendous achievements so far in the fight against insurgency and encouraged them to do more.
Let's go to Bayelsa State now, in the southern part of the country, where the government is looking at innovative ways to fund several government health projects and programs. It also says that it is ready to continue supporting the private sector in implementing healthcare-related projects. These commitments were renewed by the state government at the Promosi close-out ceremony in Yenagoa, which seeks to educate pregnant women on the dangers of HIV and the prevention of mother-to-child transmission. The cherry news and the progress of the project is that the rate of HIV and AIDS prevalence has now dropped from 9.1% in 2010 to 3.8% in 2014.
The human immunodeficiency virus, known by its more popular acronym of HIV, is a serious disease that, if left untreated, could translate to a stage of infection called AIDS. The disease could be transmitted through a number of ways, one of which is from mother to child. This is perhaps the reason why the Bayelsa state government is offering a free maternal and neonatal child health service, which is also compulsory for all pregnant women in the state.
It gives me great joy to be here today.
It's the second phase of the project, which seeks to increase the utilization of antenatal care and knowledge about prevention of mother-to-child transmission, where HIV is suspected in the mother. Impressed with the outcome of the project, which started in April 2016, the state government promises to do more to aid pregnant women who are diagnosed with HIV/AIDS.
All pregnant women, inclusive of HIV-positive women, are now the responsibility of government.
A beneficiary of the project recounts her experience.
But they taught us how to save money. There are 2 ways of saving money, the mandatory and the voluntary. When they imparted this knowledge in us, we in turn imparted to other women. We started doing it we realize much money, we can use that money to take care of our families in the absence of our husbands.
Following the success of Promote 1 and 2 in the state, the third phase may be in the offing to ensure that healthcare is accessible to all.
For us, the main thing is to see how we can work with communities to create solutions, like I said, empower them, particularly the women and children. And 6 years down the line, we can comfortably sit back today and rejoice to say that there's been remarkable changes in the lives of the women and communities that we have served.
The people of Bayelsa State are also in for better days, as the state government says it's ready to take the health project a notch higher.
When News Across Nigeria returns in just a moment to find out the latest warning coming from the Independent and National Electoral Commission, INEC, to politicians. Stay with us.